far more people seeking support for different mental health related challenges during this time of year, which is not a coincidence. And actually, research shows a seasonal pattern in mood changes, usually with higher rates of depression or low mood in fall and winter months. So this is often called seasonal affective disorder, or seasonal depression. And if I can, I will do a similar video in Amariña. But anyway, so we have shorter days during the fall and winter season, which can disrupt our circadian rhythm, that is our internal clock. And having less daylight can affect our hormones like serotonin and melatonin, which regulate our mood, regulate our sleep, regulate our energy levels. So that's why during winter months, many people may feel more tired than usual, right? So more fatigue. They may also notice changes in their sleep patterns, like sleeping more than usual. You may also experience weight gain during this time, or cravings, especially for carbs. Some people also experience just low motivation, right? Or less interest in things that they used to enjoy. There could also be feelings of sadness, of irritability, of hopelessness. So this is what we call seasonal affective disorder, or seasonal depression. And even if you don't meet full criteria, it's very common to feel some of these symptoms, or experience some of these challenges as the days get shorter. And I also want to talk about some things that might be helpful, some things that you can try and see if it's helpful for you. The first one is morning sunlight. So I talked about this in a previous video, but spending 10 to 15 minutes outside within the first hour of waking up. Even if it's cloudy outside, it doesn't matter. So spend a little bit more time outside, specifically in the morning. Second one is light therapy lamps, and they mimic sunlight, and that could also be very helpful. And there's a lot of research showing its efficacy or effectiveness, and I'll try to post some studies here. Third is structure. So keeping a consistent sleep-wake cycle, sleep-wake times, having regular meals at specific times. So keeping a consistent schedule can also be really helpful. The third one is movement, incorporating as much movement as possible into your day. It does not have to be rigorous exercise, but something as simple as going for a walk. It could be stretching. It could be standing when you're working. So just having as much physical activity and as much movement as possible into your day can be very helpful. You can try these out, see if they're helpful. But in general, if your mood is a little bit lower than usual, if you're feeling more fatigued than other times, you are not alone.